Okay, printed final restorations. Can you do it? Yes. Would I do it for anything but a lateral upper incisor right now? Probably not, unless we talk to the patient and they're one of those candidates that are saying, hey, I'm going to Canada tomorrow, I need something right now. You'll tell them, or for example, if they can't afford a final one, they're like, I really want an implant, we can always pitch a printed restoration. You'll tell them, be careful with it, it'll resemble a tooth, but if you break it, just pay us a material fee, we'll print you another one, we'll deliver it. So it could be like a little membership fee on having a tooth that's not fully durable, but could function for the time being. Okay, restorative scanning. So do we all have an iTero or Medit or something like that? Okay, so at least eventually we will, because to do all this stuff, we need an intraoral scanner. So the most important thing to do when you're scanning these cases, and actually, if you look up a YouTube video on the iTero website, it shows you step-by-step directions how to scan an implant fixture level scan with an impression coping, with a scan abutment. It shows you all the steps, and the most important one, they don't even include it in their own video. Because the most important step is the pre-operative scan. This is the same scan you press for scanning a crown if you want to replicate the exact crown they had before. But the reason we press that is because we spent all this time shaping their tissue. If we just put an impression coping in and scan that without scanning the tissue first, without anything in there, you just wasted like 3 months of your time. So I'll walk you through the steps. I took some pictures. So what is a scan body? We should all be familiar with this right now. It's basically this plastic thing you put in there that communicates to the lab where your fixture is in the bone. Now, here's an example. I documented the scan here. This is recent. So they were wearing this APG for, I would say, 3-4 months. You take it off, you see some tissue, which doesn't look too healthy because the APG was a little bit loose, but that's okay, we shaped the tissue. So the tissue there, we will scan with the preoperative scan. So that's your scan number 1. You're taking the wand, you're scanning the whole upper arch, and when you're done, one really important aspect of this, when you take your healing abutment off, make sure to scan the tissue within a few minutes. Because you take the healing abutment off, and then the tissue is going to start closing in pretty quickly. And then you're going to have to numb them up to put it back in there, because you're going deep, the tissue is going to be closing over this fixture right here, and then it's going to be pinching, the patient's not going to be too happy. So after the tissue scan, that's when you put your impression coping in. Then you do a scan of the actual impression coping, and then you click next, and then you do a scan of the whole arch again so that it stitches your impression coping to the whole arch. And you basically run down the line of the iTero steps, restorative steps to scan. It'll say scan upper arch, scan lower arch, scan number 13 or whatever that was, and then scan the bite. And then at the end, if you're missing a scan or two, it's going to tell you, hey, go back in this process, put some more information in there.